It's summer and you're spending a lot of amazing days in the beautiful sun. It's awesome, right? Yes. So sorry to be the party pooper, but let's talk about skin cancer and why sunscreen matters more than you might think. So let's start with the facts. First, melanoma rates have been climbing for decades. And then the non-melanoma skin cancers, basal cell squamous cell carcinoma, have also been increasing, and they're directly related to sun exposure, the UV light. The good news is sunscreen actually helps, but the problem is most people don't use it like they should. Now, I work with a lot of people who have skin cancers on their face, and on your face you actually have a danger zone. We call it the H zone. It's this high risk area that runs right down the middle, your nose, your upper lower lip, your chin, and then your eyelids, eyebrows, temple, and the external ear. What's been found is that skin cancers in this H zone tend to be more aggressive, tend to recur more often, they're harder to treat. So any skin cancer that's in the H zone is considered higher risk. Now, there's one part of the H zone that people tend to completely forget as well. It's the external ear, okay? So thin skin, direct sun exposure, not great. Skin cancers on the ear are surprisingly common, more common in men, and they are often caught late because we don't tend to look at that area as closely. It's can hide behind the ear or in the little nooks and crannies of the ear, so they can be missed pretty easily. Now, believe it or not, studies have shown that people that do use sunscreen, there's only about 1 in 4 that actually even puts it on their ears. And so you've got 25% that do, 75% that don't even protect their ears. Throw on a ball cap, they're just exposed, going to get cooked. Now, good news is sunscreen works. The only randomized trial that looked at sunscreen with melanomas found that daily use of sunscreen cut melanoma risk in half. And the more aggressive invasive melanoma, 73% lower. So that's great. The problem is other studies have shown that people don't apply sunscreen like we're supposed to. The average person only applies about half the dose that's recommended, and then we don't reapply as is recommended every couple of hours after swimming or after you sweat and get really wet. So here's what we recommend doing. Make it a process, okay? 3 steps. First is grab that H zone right down the middle. Make sure you get the nose really good, upper lower lips, chin. Get the eyelids, eyebrows, and then step 2, make it a process. Don't forget it. Ears, make sure you get both ears. Step 3, grab the forehead, cheeks, and then back of your neck. Lower risk in those areas, but plenty of sun exposure, as everybody knows. It's recommended that you use at least a 30 SPF or if not higher, and make sure you apply enough and then reapply again every couple of hours or after swimming or heavy sweating. So remember to protect yourself now so you can avoid skin cancer in the future. Now you knows, follow for more.